This video will discuss stimulant use disorder. And stimulant use disorder is a condition that has a severe impact on the people who are living with it. Examples of stimulants include cocaine and methamphetamine, for example. In the United States, about 4.3 million people, or 1.5% of the population ages 12 and older, had a stimulant use disorder in the year of 2023. 2 videos ago, I introduced opioid use disorder and talked about how that had a severe impact on the city where I spent most of my adult life, Baltimore, Maryland. And now I'm discussing stimulant use disorder, which had the largest impact on the area where I was raised, specifically in the Washington, D.C. metropolitan area where I lived in Maryland, but just a 19-minute walk or 4-minute drive to the Washington, D.C. line. That specific substance that had a major impact on the area was cocaine, and more specifically crack cocaine. Now, returning to stimulant use disorder. Again, 4.3 million people in the United States had a stimulant use disorder in the year of 2023. Stimulant use disorder describes meeting at least 2 of the 11 symptoms that are present when someone has a substance use disorder. I think about 10 videos ago, I described these 11 symptoms of a substance use disorder diagnosis, but some of these examples include tolerance, withdrawal, and craving. What's really interesting is while caffeine is indeed a stimulant, and a stimulant is something that activates our central nervous system. So while caffeine is indeed a stimulant, diagnostically, it's in its own category and separated from stimulant use disorder. In fact, technically, caffeine cannot cause someone to meet the criteria for a stimulant use disorder diagnosis. As of today, April 23rd, 2025, there is no caffeine use disorder diagnosis. But that's today. I will discuss this in the future, but there is a strong possibility for a future caffeine use disorder diagnosis. So while there is no caffeine use disorder diagnosis right now, and while there is no stimulant use disorder related to someone's caffeine use, there may be one in the future. And currently there are indeed conditions related to caffeine, such as caffeine intoxication and caffeine withdrawal. That's a short introduction to stimulant use disorder. Up next, I'll introduce tobacco use disorder. Thank you.